Nasion hump problems are not uncommon in Asian. Most of them is low-type deformity. First, we need to understanding the nasion. The nasion is the anatomical junction where the nasal bone meets the cartilaginous part of the nose. This area plays a crucial role in nasal aesthetics, and any irregularities in its contour can significantly impact facial harmony. A pronounced or irregular Nasion hump can create an awkward appearance, affecting the overall profile of the face. Patients often seek correction for this concern to achieve a more balanced and refined nasal contour. Again, there are two types. High type. The prominence is significant and high, often requiring reduction surgical intervention. Thread treatment cannot help much. Low type. The hump is more subtle, comprising of a low radix, low anterior nasal ridge with derotated tip, with the Nasion hump in between, making non-surgical options viable by simply refilling the deficit volumes of the radix and anterior half of the nasal ridge by threads. This is the low-type Nasion hump on the left side and after thread treatment on the right side. You will see not only the Nasion hump is camouflaged, the nasal dorsum height is also improved. It looks double more pleasant aesthetically. A deviated or crooked nose is a common aesthetic and functional concern that can result from congenital factors or acquired conditions such as trauma. The deviation can impact both the nasal airway and facial symmetry, making correction an essential aspect of medical aesthetics. Crooked nose, or more professionally nasal deviation, can be classified into two primary categories: congenital deviation, present at birth due to genetic or developmental factors. Acquired deviation results from external trauma, surgical complications, or progressive structural changes over time, while previous surgical interventions may have introduced grafts to support nasal structure and improve function. However, it is traumatic with long-time recovery. While a non-surgical camouflage approach is often employed to correct mild to moderate nasal deviation. This technique involves the strategic use of threads to create the superficial structure of a straighter nose. This enhances nasal symmetry without invasive surgery, providing immediate yet temporary correction with minimal downtime. This approach offers several benefits, including minimally invasive nature with no need for surgical intervention, quick procedure with immediate visible improvements, low risk of complications compared to traditional rhinoplasty, customization to suit individual patient needs. This is one example of deviated nose, and insertion of corrective threads as shown in the left picture will give rise to the result of the right side. You may notice not only the deviation is improved, the ilar and nostril asymmetry are also corrected.